So it's important to realize that ketamine by itself is an anesthetic agent. In any other place in the world, if you receive an anesthetic, you should have an anesthesiologist, somebody who's been formally trained. It would be grossly inappropriate to go to a place and receive an anesthetic agent by a non-anesthesiologist, largely by somebody who doesn't know the practice or doesn't know what to do in case of emergencies. So in this case, or in this particular facility, if there is an emergency, we are better equipped than most facilities. We do meet our requirements. We meet the state and the federal requirements. We do have a concern about people receiving anesthetic agents outside of normal guidelines. Our big concern right now is that, yes, there are facilities which do it without an anesthesiologist. There are some places where nurses are administering the medications. Should a nurse be administering an IV anesthetic without proper training? That raises a red flag with me, and I think it should raise a red flag with everyone, that if you're going to be treated in a medical facility, in a supervised medical facility. So one of the biggest concerns that people have, and people always ask me, well, I utilize ketamine as a recreational drug, what's the difference? So let me tell you what the basic difference is. If you use ketamine or any other agent as a recreational drug, you're using a higher dose, you're using an uncontrolled dose, and the clinical studies and the scientific studies have shown you are damaging the brain. If you're utilizing ketamine by itself, it's dangerous. If you use ketamine in a controlled environment and you utilize Versed or magnesium sulfate or any other agent to cause some stability in it, you will cause the brain to grow. So the choice is really yours. Use ketamine and shut your brain down and kill it, or use ketamine in a controlled environment with the proper agents and allow it to regrow.